You're watching CTOM TV. Knowledge is power.
What are the best treatments for ER-positive breast cancer?
That's a great question, and there's been some amazing new developments in breast cancer in the last few years, especially estrogen positive, but also triple negative, and definitely HER2. We've seen so many incredible advances just in the last few years, and once we find a targeted pathway that works, most companies start building drugs for it. So one of the things that we look at with sequencing is we look at a set of pathways that are fairly important. The first pathway is a PIK3CA pathway. And so if you have mutations in this pathway, there's a new drug called alpelisib, and it targets that. And when you combine it with an estrogen blocker such as fulvestrant, it works quite well, and especially in advanced patients, it gives them more time. So that is one of the new pathways that's really nice. And we're specifically focusing on ER-positive breast cancers right now. Okay. It's very different for triple negatives and triple positives.
Okay.
So PIK3CA is for ER-positive. And then there's also BRCA1 and 2. Yeah. And for them, PARP inhibitors. But also there's some indication that even for estrogen-positive breast cancers that don't normally respond well to immune therapy like PD-1 inhibitors, if you use a combination therapy with a PARP inhibitor and immunotherapy, and you have a BRCA mutation or something, there is a tendency for a much better response in those patients. And then, of course, we have HER2 mutations, which is one of the newest things. So normally in HER2-positive breast cancer, what they do is they count the copies of the HER2 gene, and it's called, well, how many different HER2 receptors you have, and that's called overexpression of HER2. But what we know now is that you can get mutations in actual HER2 gene. So the gene itself can be mutated. And when you have mutations in the gene, then it kind of overrides the signaling pathways that the estrogen inhibitors are blocking. And it opens up an alternate pathway. So there's a new drug for that called neratinib. And that also blocks a PIK pathway too. So neratinib is really important. So whenever we see an estrogen-positive breast cancer patient, and they've had breast cancer for many years, and all of a sudden they stop responding, their cancers start coming back, one of the first things we do is we look for either a PIK mutation or we look for a HER2 mutation. So both of these classes are emerging mutations.
And there are targeted therapies for them.
Targeted therapies for them, yes.
Yeah. Was there more you wanted to add about that before I interrupted you? No? Okay.
Thank you for watching CTOM TV. Subscribe below and stay informed.